talk about expectorants यानी कि mucokinetics. Okay, so expectorants are the drugs which are used to increase bronchial secretions, which in turn thin mucus so that it is cleared more easily out of the airways. So what happens? Mucokinetics, they increase the bronchial secretion. As a result of that, mucus get thin, and thin mucus easily comes out of the airways while coughing. Okay, so how does these drug work? They increase bronchial secretion as well as they decrease the viscosity of expectoration. यानी कि spurt यानी कि they decrease the thickness of the mucus. So okay, so look at this. This is a bronchi, and there's an increased production of the mucus. And when these drugs work on these bronchioles, okay, the mucus get thin, and it easily comes out of the bronchioles by coughing. Okay, and here we have some examples of these expectorants: potassium iodides, guanine, phenicin, sodium citrate, potassium citrate, volatile oils. So these are the examples of these expectorants drug. Now we have some conditions. In these conditions we can use these expectorants like cold, minor bronchial irritations, bronchitis, influenza, sinusitis, bronchial asthma, emphysema. So in this condition we can use these drugs, but remember, these drugs are used in combination with the antitussive and antihistamine drugs. Antitussive drugs are used in the treatment of dry cough. Okay, now let's talk about the adverse effect. When these drugs taken in large amount, they can cause vomiting, diarrhea, drowsiness. Okay, and abdominal pain may also occur because of these drugs, headache and skin rash. So these are the adverse effects which are caused by these drugs. Okay, we have some nursing responsibilities. Okay, when a patient taking these drugs, we can assess these things in the patient. Like we have to assess the patient sputum production before and after giving medicines. Okay, सपोज एक पेशेंट है जिसको हमने मेडिसिन नहीं दिया है, और देने के बाद हमको उसमें बॉडी के अंदर क्या चेंजेस आ रहे हैं, उस स्पुटम का प्रोडक्शन कम हुआ ज़्यादा हुआ, ये हमको असेस करना है. As well as we have to alert for the adverse reaction. As a nurse, we have to look for the adverse reactions in the patient. As well as we need to evaluate the patients and family knowledge regarding the drug therapy. Okay.